Hi, Steve Arterburn here, and thank you for joining me for Going Deeper. Today, we're going to go deeper into a really frustrating dilemma, and it's so easy to misunderstand it. We're talking about obsessive compulsive disorder. Now, before we talk about the real live obsessive compulsive disorder, I want you to think about something that people without that disorder do, because it's different. But if we have just a normal compulsion, let's say, it could be because there's an unresolved emotion. Let's say when I'm growing up, I feel inferior, okay? So as an adult, I obsess over wanting to be better, wanting to be seen as competent and capable and more brilliant than anybody else. So I become obsessed with that. And so in order to do that, I have this compulsion to work hard, do anything I can to succeed. Those things are decisions that we make, are awarenesses that we have. And what I'm going to describe is something beyond a decision. In other words, I decide that I want to be seen as powerful. Now, I might not even know I've decided that, but there's a choice. And I decide that I'm going to be successful and I'm going to work hard so that people perceive me with this competency because I felt so inferior. So if I go back and work on my inferiority that I had growing up and see that it's not real or it doesn't matter, if I do that, then I don't have a need to look superior or strong, so then I might stop working so much. So that's just a normal kind of compulsion over here or addiction over here, an obsession that leads to that, and an unresolved emotion. But I want to talk to you about true OCD. It is an anxiety disorder. Many people believe it is genetic. And it's a recurring of thoughts or a deep emotion, feeling that comes from the thoughts, and very irrational ideas. And I become obsessed with things, and I take obsessive, or you could say excessive, attempts to control things. Dirt, I don't want it. Germs, I can't stand them. Anything like that. Maybe it's a way of trying to protect myself from these threats that I think could really destroy me. And so, I might become perfectionistic, thinking that if everything was in order, then I wouldn't be crazy. And I really want to stress that I'm not causing this obsession. It just overtakes me, and the solution to my obsession, counting or washing frequently or whatever the compulsion is, hoarding, the solution that I choose becomes problematic, becomes a problem, doesn't help. It doesn't resolve this anxiety, this fear that something's going to happen. And so I have this behavior that must be performed, and no matter what I do on my own, it doesn't get better. So I want to give you some things to help you help somebody who might be struggling with this particular problem. So we want to understand while we love this person. First of all, this is going to be a lifelong companion of the person that you care about. It's not just magically going to go away. It's what is called a chronic condition. It just keeps going. And really what's helpful and hopeful is when a person comes to that place, and many times they come to that place by encouragement from another, where they see that I have an extreme limitation. And no amount of hard work or insight or strength is going to overcome this extreme limitation called OCD. All right, so if If I care about this person, I accept that they can't just pull themselves up by the bootstraps and it's going to all be okay. Now, second thing, I need to know about the tools that are available to the person with OCD that I care so much about. Now, just going and doing talk therapy isn't going to help. If I go back and look at how much I resent my mom and dad, that's not going to help. There is a thing called exposure and response prevention. And what it is, a very trained therapist in this area helps the person gradually confront the trigger or the anxiety or the fear. They gradually start to confront that and talk about how irrational it is compared to what other people are doing. They eventually help them see that when they resist, the bad thing they thought that was going to happen doesn't happen. And so they are helping them confront the trigger and then resist performing the compulsion that they see as the answer to the problem. Now, it takes a very trained person. And you could say it's a behavioral thing, and it's an examination piece where we're resisting doing the behavior, and then we can see that the thing I feared most didn't come true. I'm learning that nothing happens when I don't perform whatever it is I feel compulsed to perform. And I'm learning to tolerate things over here, this obsessive thing, this fear, this anxiety. I'm learning to tolerate the fact that that may not magically and wonderfully go away or be resolved. And so I'm going to learn to live with it. So I'm doing some things. I'm learning to tolerate. I'm also learning to challenge the underlying logic that I'm using. If I don't do this over here, this is going to happen. And it's irrational. This, washing 18 times, taking a shower 18 times a day, isn't solving the problem of germs or skin disorder or whatever. It's creating a problem. When I worked in the psych hospital, I remember this woman, she just simply never stopped taking a shower, and her skin was so red from all of the showers that she took. They became dry, and it was just horrible. So what we're trying to do is we're trying to help a person see that this isn't helping. So we're helping them see that it doesn't help. And also we want to help them and we don't want to get them all obsessed with family of origin or a character defect or anything like that. We just want them complying with the qualified therapist that they're working with. That's the goal, is compliance. Now, in the area of compliance, we've got this medication stuff. So we've got tools that with a therapist that we can implement and we can maintain, help them do that. But then we've got this medication issue. Now, medication alone usually isn't the answer, but it's part of the answer. And medication isn't perfect, but you could say it's pretty good in its help. And sometimes it just turns off a switch, but you still have to do the other things or you'll end up in relapse. And there's a high incidence of relapse in the medication-only crowd. But to resist the medication is quite common. People don't want the medication. They come up with all sorts of obsessions of what the medication is going to do, anxieties, fears. Somehow, you're going to have to help them. And maybe it's seeing the research that is done on a particular medication. Help them see that this is not quackery, or that they're not putting their health in danger, or their brain, or something like that. So, and then, so you want the medication in there, never stop it. Maybe you try to get it adjusted to perfect it even more, but you just keep taking the medication. Now, the tools that I have along with the medication, creates a situation where I can become my advocate, my coach, and my therapist, so that I'm the one that's looking at the irrational thoughts. I'm the person that is resisting, and I'm doing it without a therapist in the room. So I'm my own therapist, or I'm coaching myself through it, and it will get better. I'll have to come to an acceptance of the way the world is and the way it impacts my brain. Now, here's something. If you were to enter therapy and get on medication, there is a good chance it might take 6 months for you to experience a life that's pretty close to normal. Now, if you've got a really complicated situation combined with abuse and things like that, it's going to be even longer. So it takes time for the treatment to impact the person. So don't expect a quick fix or an instant solution from the person that you care about. And when you're medicated and you're using the tools, then the rest of your life becomes a process of relapse prevention. Relapse occurs when I get complacent. I stop doing the things that are helpful. And then if I get complacent, I start to get confused. I start to think again, hey, I can handle this. I know, I've got insight. My intuition is going to lead me to a better place. And it just doesn't do it. That's relapse. So I relapse when I stop doing the healthy stuff. I relapse when I start questioning. I get confused. And I realize when I start to compromise, where I really get some out of control behavior going. It's not pretty. And so I want to keep my program going. Medication, using the tools. If I find the tools are kind of not working very well, more therapy to kind of re-strengthen or revitalize the tools. And each time, what I'm trying to do is confront the obsession and resist the compulsion. And you can get pretty good at doing that. When you have this thought that I have germs all over me, which we all do, and they're eating me alive or they're going to kill me. And then I can look at the rest of the world population and see how few people really have that fear. And how long people live, like 100 years, some people, 110 years, and the bacteria or the germs or the dust didn't take them down. And so the other thing in the area of relapse prevention, of course, doing the normal stuff that normal people do. Getting good sleep, good nutrition, avoiding high sugar, high simple carbohydrate food like white flour, white bread, white icing, anything white, could be suspect. So I'm doing all that, and I'm getting some exercise also, which changes my physiology and kind of the chemical makeup that's going into my brain. So I do all that, and I never stop doing all of that. So when you're helping someone, you're encouraging them. You're noticing, wow, you're not sleeping, or you're not eating a healthy diet right now. So you notice it, you bring it up, and you ask, what could I do to help you? You don't criticize, you don't judge. You're just there to assist. Wow, I've noticed that all the good stuff that you were doing for so long, it's not there. You're not resisting the compulsion. You're not confronting the obsession. Your diet's horrible, and you look miserable, and you're not taking your medication. So we need to help them see when they fall off that that is relapse. It's not whatever you think it is. It starts when they get complacent. So you want to be there for them. They need to know they can count on you to be there for them. No judgment, no criticism, and certainly no rejection. Now, I do a workshop called Finding Freedom, and it's one of the places that we reinforce folks who are struggling in this area. I think it would benefit you greatly. But sometimes the compulsion becomes a problem in and of itself. And so like we could end up with a sexual addiction or something of that nature, and we need to get that addiction treated as soon as possible. Well, that's my going deeper into obsessive compulsive disorder, trying to be a person that helps rather than hurts when somebody I love has the problem. So that's it for me. Thanks for joining me for Going Deeper. So if you need some help, call us 1-800-NEW-LIFE. See you next time.